Hello everyone, welcome to our low back pain webinar brought to you by Lab AccuWellness Foundation Inc. Today we will discuss the auxiliary treatments for low back pain, auriculotherapy, scalp acupuncture, Gua Sha, Moxibustion, and cupping. Auriculotherapy is an application of physical stimuli in specific auricular points. This may be a potential strategy to face the challenges that low back pain brings to the health system and society, since studies have shown promising results in its application in the low back pain management with reduced pain intensity and improved functionality. Low back pain is one of the most widespread public health problems worldwide, affecting 60 to 80% of the population. The largest apparent increase in disability caused by LBP in recent decades is in low and middle income countries, including Asia, Africa, and the Middle East. In primary health care, LBP is among the most prevalent pain conditions, generating a great demand for the health system, becoming costly for both the individual and society. The LBP is nonspecific in the great majority of cases, and this type of LBP occurs when there is no suspicion or confirmation of primary disease or known cause such as a tumor, fracture, osteoporosis, and radicular syndrome. In this context, treatment focuses on reducing pain and its consequences through pharmacological and non-pharmacological approaches such as education and exercise. However, overuse of drugs can be a problem, as with opioids. In this sense, complementary practices can reduce the medicalization of care, promote the importance of subjectivity of the subjects, and bring new alternatives of actions with the use of less expensive and more adequate resources for comprehensive care of the human being. Studies suggest that auriculotherapy is an effective therapy in the treatment of LBP, especially with the use of points such as Shenman, lumbar, kidney, sympathetic, and subcortex. However, due to the limitations of the analyzed studies, such results are probably not generalizable and should be evaluated with caution. More robust RCTs should be conducted. The art of healing with pressure over specific points on the ear is known as ear acupressure or auricular therapy. Ear hosts over 120 acupoints that correspond to various parts of the body. Traditional Chinese medicine teaches that energy pathways, or qi, or vital life energy, pass through the ear. When you stimulate an acupoint, abundant flow of energy returns to the related organ or area, allowing healing to take place. The ear is said to be a micro-imitation of the human bodily system, comparing the shape of the ear to an inverted fetus. The mapping of inverted fetus to the outer ear roughly explains the connection between ear acupoints and their corresponding body parts. Auricular therapy is not just simply acupressure to unblock energy meridians of the body. Rather, ear acupressure stimulates the nerve connections between the ear and the central nervous system. By applying pressure to the correct points on the external ear, triggers nerve impulse from the ear to the brain, thereby communicating powerful healing messages to the organ or system in which the health problem manifests. Upon stimulation, the brain releases pain-relieving protein molecules, endorphins, into the bloodstream, soothing chronic pain and discomfort quickly and with no side effects. Instead of using needles to stimulate the acupoints, small beads can be used to apply pressure to the points. In TCM, seeds of natural Vaccaria plants are used as they are tiny enough to sit precisely over one pressure point. The seeds are put in place using tapes. For people who are not sensitive to metals, they may opt for metal beads or pellets. Moreover, magnetized beads are said to further enhance the effectiveness of the ear acupressure. Application of ear seeds can be used alone or as complementary therapy to acupuncture or body acupressure in order to treat a host of symptoms. There are numerous benefits of using ear seeds. They can be used in the comfort of your own home, simple to adhere, help supplement traditional acupuncture in between sessions, suitable for those who do not want to receive acupuncture or those with needle phobia, small, not extremely noticeable, no side effects, safe, wearers receive prolonged benefits, natural, holistic, drug-free relief, and helps promote general well-being. Precautions. Not to use when pregnant. Patients should consult doctors first. Do not apply when the ear is infected. Do not apply when the body is in very weak state, for example, when drunk, starved, super intense mind state. If skin irritation or swelling occurs, remove ear seeds and consult doctor if symptoms persist. Adhesive tape may contain latex. Slight irritation may occur if you're allergic. For people who may be allergic to latex, test the tape on the skin on a single location before applying to various points. How to apply? To begin, you will need hair clip, alcohol, an ear probe, a set of tweezers, and ear seeds. Use a hair clip to secure the hair away from the ear so that it does not contaminate the auricle during treatment or attach to the sticky tapes of the seeds. Remove ear jewelry and piercings. Palpation is the process of detecting tender points for treatment. Apply equal pressure using a sterile stainless steel ear probe in palpating the points related to your condition. Referring to placement chart, mark the point for treatment by pressing with the probe so that you can remember it. Clean your outer ear, best with 75% alcohol swab. Make sure it is dry before applying ear seeds. Pick up the plaster with a pair of tweezers so as to touch the adhesive as little as possible. Affix the ear seed to the acupressure point on the ear. Continuous mild pressure that ear seed exerts is amplified by stimulating the seed with fingertip massage. Massage the ear seeds 3 to 5 times a day for about 30 to 60 seconds each time. A good time to massage is after meals and before sleep. Due to sweating and showering, the ear seeds usually need to be removed after 3 to 5 days or shorter during summertime. For better results, alternate the ear for application of ear seeds such that each ear has sufficient time to rest before acupressure points are stimulated again. Do not reuse ear seeds. The World Health Organization considers auricular medicine a form of microacupuncture that can affect the whole body. Although popular in Asia for over 2,000 years and in Europe for the past 60 years, it has not yet become widely practiced by healthcare providers in the Philippines. Despite this, auricular therapy has shown some promising results for pain management. A recent meta-analysis of auricular therapy for pain management reports that auricular therapy can not only reduce analgesic use for perioperative pain, but also reduce pain intensity for acute and chronic pain. Scalp acupuncture for low back pain. Chinese scalp acupuncture is a contemporary technique combining traditional Chinese needling methods with Western medicinal knowledge of various representative areas of the cerebral cortex. Scalp acupuncture has been proved to be an effective technique for treating acute and chronic pain due to CNS disorders ranging from phantom pain and complex regional pain to strokes and multiple sclerosis. The scalp somatotopic system appears to manifest the convergence of the central nervous system and the endocrine system. Using a small number of needles, scalp acupuncture can often produce remarkable results almost immediately, sometimes taking only several seconds to a minute to complete. Clean insertion site with alcohol. Use 1 to 2 Sun filiform needles, 28 to 32 gauge. Insert at 30-degree angle, thread into the aponeurosis. Twirling manipulation up to 200 times per minute. Manipulate 2 to 3 minutes, rest 5 to 10 minutes, and repeat 2 to 3 times, or use high-frequency e-stimulation. Treatment principle for point selection. The forward part of the zone nearer the face is used to treat the upper body. Rear part of the zone, the lower body, and the functional zones, the sensory, memory, and motor, the back and sides of the scalp. Standard acupuncture of scalp points would require subcutaneous insertion up to a depth of 1/2 Sun or less. This is about 0.3 to 0.5 inch at a high angle of 60 to 90 degrees. In scalp acupuncture, needles are inserted at low angle of 15 to 30 degrees. Insertion distance of 1 Sun. Standard acupuncture applied to scalp points would require less rapid stimulation or Moxibustion as main stimulation technique. In scalp acupuncture, we stimulate needles for 2 to 3 minutes at a time with rest period of 5 to 10 minutes between stimulations. The technique is small needle therapy in which shoe points in the scalp are treated. Shoe points are stream points where qi of the internal organs is infused. In body acupuncture, there are 5 shoe points on each of 12 meridians below the elbow or below the knee, plus back shoe points, each located in the vicinity of internal organ. Shoe points in the head can be used to treat diseases of the whole body. Sensory area is located on the projective area corresponding to post-central gyrus of the frontal lobe. This is most commonly used in Chinese scalp acupuncture. Located parallel to the motor area, 1.5 cm posterior to the motor area. The sensory area controls and adjusts sensation in opposite side of the body. One side of the cerebral cortex controls contralateral sensation of the body in the level below the neck. Exception: most of the sensation of the head and face are bilateral. The upper part of the gyrus controls the lower limbs. Middle part dominates the upper limbs. The lower part controls the head and the face movements. The post-central gyrus contains the primary somatosensory cortex, a significant brain region responsible for proprioception. This region perceives various somatic sensations from the body, including touch, pressure, temperature, and pain. These are the indications of the sensory area. Abnormal sensations of the face, trunk, limbs, either hyposensitive or hypersensitive, including pain, tingling, numbness, loss of sensation in the contralateral side of the body. The following disorders have shown positive results: loss of sensation or pain from stroke and traumatic injury, numbness and tingling from multiple sclerosis, phantom pain, complex regional pain, residual limb pain, trigeminal neuralgia, TMJ dysfunction, migraine headache, cluster headache, shingles, pain in the neck, shoulder, back, and lower back, sciatica, gout, plantar fasciitis, fibromyalgia, neuropathy, and paresthesia. Abnormal sensations of an extremity are treated by choosing the opposite side of the sensory area in the scalp. For example, if a patient has pain in the right leg and foot, the left side of the sensory area in the scalp should be needled. For patients having brain surgery and injury where part of the brain was removed, needles should be placed on the same side of the scalp as the affected limb. For example, a patient with numbness in the left leg and foot would be treated with needles on the left side of the scalp sensory area. Scalp acupuncture produces excellent results for pain, numbness, tingling. Many patients show significant improvement during initial treatment. Scalp acupuncture results in much quicker effects compared to other modalities of acupuncture, such as in the ear, hand, or body. Some patients felt improvement just a few seconds or a few minutes after their scalps were needled. The upper 1/5 represents the abnormal sensation and pain in the lower extremities, trunk, back, chest, and neck. The middle 2/5 would be the upper extremities, and the lower 2/5 problems with the face and head, including migraines, headaches, trigeminal neuralgia, toothache, and TMJ. Precautions. Seated or lying position. Watch for fainting. Scalp acupuncture is not advisable for weak patients, those with high fever, local inflammation, heart failure. Contraindicated if open head wounds or intracranial bleeding. Wait until bleeding has stopped and the patient is stable. Electroacupuncture therapy is a technique that is done by inserting the acupuncture needles in the scalp and then connecting the electro machine to stimulate the point. Use electrostimulation instead of hand stimulation to treat disease. The electro machine can perform fast rotation, stabilize the treatment, and control the stimulation. Select 2 or more points at the time of stimulation. The current level should be chosen based on the amount the patient can handle. Usually, choose a small amount of current to stimulate the point for 1 to 2 minutes, and once the patient becomes accustomed to the stimulation, increase the current. Treatment time for electroacupuncture therapy should be 10 to 20 minutes. Use electroacupuncture for conditions such as headache, dizziness, tinnitus, deafness, seizures, chorea, facial spasm, hysteria, stroke, or aphasia. Treat the patient once daily or every other day for 10 treatments per course with 7 to 10 days between courses. For more details, please refer to our video on TCM electroacupuncture presented by Dr. Webster Lin, President of the Philippine Acupuncture Association, Inc. Electroacupuncture therapy should be used with caution for the following. Points close to the medulla, such as DU15 and DU16. On the lower lateral line of the occipital area, use caution with the intensity of current used. Choose the right amount of current so that the patients feel comfortable. Take care not to increase the current suddenly or in large amounts, because there is a dangerous possibility that it can cause the heartbeat or breathing to stop. Electroacupuncture is contraindicated for patients with cancer or severe heart disease. During the treatment, the practitioner should be careful not to bend or break the needles. Gua Sha for low back pain. Gua Sha therapy improves pain intensity in patients with chronic low back pain. The treatment further improves overall health status. Gua Sha therapy is not associated with serious adverse events in patients with low back pain. Chronic low back pain is a major public health problem in industrialized societies with a global average lifetime prevalence of 40. In Germany, almost 1 in 4 adults over 30 years reports chronic low back pain. This is one of the major causes of work absenteeism and disability. Given that an optimal clinical treatment has yet to be identified for this condition, patients often seek complementary and traditional therapy treatments. One such approach is Gua Sha therapy, an instrument-assisted pressure stroking of a lubricated area of the body surface. Sha literally means sediment or sand, but in traditional medicine, the term is applied to a syndrome or toxin in the body as well as its rash-like expression. Gua means to scrape or scratch. Thus, Gua Sha is a method to bring Sha to the body surface by means of scratching or scraping. Gua Sha therapy uses a variety of instruments, from slices of buffalo horn, specially made for this purpose, to round-lipped metal lids, to intentionally induce transitory therapeutic petechiae. These result from the extravasation of blood into the subcutis. They fade within 2 to 5 days. Gua Sha therapy is generally well tolerated with little or no discomfort. Gua Sha is widely used in Asia as well as in communities of Asian immigrants worldwide. It is known as a treatment in Chinese medicine and is also commonly used in Vietnam and Indonesia. It remains an important treatment technique for many acupuncturists and traditional East Asian medicine practitioners, for regional pain and for functional problems with impaired movement, including low back pain. Gua Sha has been shown to effectively treat chronic pain conditions. Gua Sha also effectively reduced pain intensity and improved general health status in chronic low back pain. Low back pain often happens to many people, particularly to middle-aged and elderly, due to irregular lifestyle, lack of rest, or physical exercise, as well as intrusion of the cold. It can also be caused by the insufficiency of yang energy in kidneys, resulting in the intrusion of the wind cold and stasis of vital energy and blood. Scraping can smooth meridians and the circulation of vital energy and blood, expel wind and disperse the cold, invigorate blood, expel stasis, and stop pain. Excess calcium loss among the middle-aged and elderly will lead to osteoporosis and low back pain. Scraping therapy can only ease such symptom for the time being, but cannot cure it. Patients would require timely medical checkup for treatment. Recommended procedures. So we have here the waist and the back. Method is use the surface scraping to scrape the painful area of the waist and the back from up to down until the Sha appears. 2. The reflection area of the wrist on the third metacarpal bone on the dorsum of the hand, and the reflection area of the spine on the medial aspect of the foot. Use the pushing and scraping to gently scrape the reflection area of the wrist on the third metacarpal bone with possible points of pain. Use the single angle scraping to scrape from back to front the reflection area of the spine on the inside of the foot. Next would be the GV14, GV13, and the Jiao points. Use the surface scraping to scrape from GV14 to GV3 on both sides of the back from up to down. Then use the dual angle scraping to scrape the Jiao points on both sides. 214 is located on the posterior median line in the depression below the spinous process of the 7th cervical vertebra. Classification: crossing point of the 3 yang meridians of the hand and the 3 yang meridians of the foot. Clears heat, releases the exterior, dispels wind, regulates wei and yin qi, treats malaria. Do14 is one of the most important points to release the exterior and treat wind heat in cold or flu. It's also a main point in treating summer heat. Do3 is located on the lumbar region on the posterior median line in the depression below the spinous process of the fourth lumbar vertebra. Strengthens the lumbar region, dispels wind dampness, tonifies yang. Jiao acupuncture points are located approximately 0.5 to 1 tsun lateral to the depressions below the spinous processes of the vertebrae. They run along either side of the spine. According to TCM theory, Jiao points regulate internal organs and benefit the spine. Jiao points have been used by acupuncturists for the treatment of pain and stiffness of the back for over 1,000 years. The discovery of the Jiao points are attributed to the Han Dynasty physician Gua Sha. As a result, the points are often called Wato Jiao acupuncture points. Wato is also credited with developing anesthesia for surgical procedures, advancing herbal medicine, developing TCM theory, and for monumental advances in acupuncture and Moxibustion. Now, modern research confirms a relationship between positive patient outcomes and biochemical responses induced by acupuncture needling of Jiao points. Wato is back in the news and his contributions continue to impact modern medicine. Number 4, we have Do4 and Bladder 23. Use the surface scraping to scrape the Mingmen point and Shanshu point on the back from up to down. Do4 is on the lumbar region on the posterior median line in the depression below the spinous process of the second lumbar vertebra. Tonifies kidney qi and yang, tonifies original qi, nourishes essence, clears heat, strengthens the lumbar region and knees. Do4 is one of the most effective points to tonify yang and strengthen the constitution. It is especially efficacious if Moxa is also used on the point. Bladder 23 is on the back, 1.5 tsun lateral to the lower border of the spinous process of the second lumbar vertebra. This is the Bakshu point of the kidney. Strengthens the kidneys, tonifies kidney yang, nourishes kidney yin and essence, strengthens kidney's ability to grasp the qi, benefits the ears and bones, strengthens the low back, resolves dampness. Bladder 23 is one of the most effective points to tonify the kidneys. Bakshu points are corresponding points on the back where the qi of the respective zangfu organ is infused. If the 5 zang organs are diseased, abnormal reactions appear on the Bakshu points. Bakshu points have a direct therapeutic effect on the diseases of the 5 zang organs. Therapy to increase the curative effect of Gua Sha for low back pain. Sit with the arms clasped round the knees and stretch the spine naturally to relax the spine joints and muscular ligaments. Before going to bed in the evening or getting up in the morning, keeping this position for 2 to 3 minutes can ease low back pain. If you're unfamiliar with this technique, Moxibustion is the warming and stimulating of acupuncture points using moxa, a dried Asian herb derived from the mugwort root and is often incorporated into acupuncture sessions. The internal causes are mostly due to liver and kidney deficiency, weak qi and blood, trauma, or strain. The external causes are mostly feelings of wind, cold, dampness, and trauma, which lead to poor circulation of qi and blood, pain caused by impassibility, blocked veins, and muscle pain after a long period of time. Moxibustion therapy is an external treatment method which is mainly made from a series of Chinese herbal medicines such as mugwort leaves. It uses Moxibustion to generate warmth on the patient's local skin and then exerts a therapeutic effect. The basic theory of TCM believes that moxibustion has the effects of warming the meridians and dispelling cold, dispelling dampness, and relieving pain. It can play an important role in preventing and treating diseases. So far, many systematic reviews have shown that moxibustion therapy in traditional Chinese medicine has a good effect on the treatment of painful diseases. A research group has repeatedly checked the literature and found that moxibustion has a certain effect on the treatment of low back pain in terms of clinical efficacy and alleviating the development of pain. Therefore, moxibustion may become an effective treatment to delay the progression of low back pain. In TCM, moxibustion is considered to play a major role through warming and drug effects. In Western medicine, the mechanism of moxibustion is not clear. Modern medical research has confirmed that moxibustion has anti-inflammatory, expelling rheumatism, dredging collaterals, and relieving pain properties, improving the body's immunity, and achieving the effect of treating both symptoms and root causes. Non-steroidal anti-inflammatory drugs have been shown to be very effective in the treatment of low back pain, but their side effects and adverse reactions are still a major problem for some patients at the same time. The key to treating low back pain with Chinese medicine is to promote blood circulation, remove blood stasis, and relieve pain. Acupuncture and moxibustion therapy can clear the blood, relieve nerve root compression, promote blood circulation in the waist, and eliminate edema by stimulating acupoints to relieve pain. For more details, please refer to the Dr. Webb Lim's Moxibustion videos. People have used cupping for thousands of years to ease back pain, neck pain, headaches, and other problems. Cupping therapy involves creating a suction force to pull blood into the skin. Cupping causes bruising and can lead to skin infection. While research on the benefits of cupping is scarce, the treatment risks are low. Cupping is an ancient healing therapy that some people use to ease pain. A provider places cups on your back, stomach, arms, legs, or other parts of your body. Inside the cup, a vacuum or suction force pulls the skin upward. Cupping is a form of traditional Chinese and Middle Eastern medicine. People have practiced cupping therapy for thousands of years. A variety of professionals can receive training to perform cupping, including acupuncturists, chiropractors, massage therapists, medical doctors, physical therapists. That sudden, scary sensation of pulling in your lower back that lets you know you're in for more pain later. The nagging daily ache that develops over time. Low back pain can really feel like a burden, holding you back from enjoying your life. If you are searching for how to reduce low back pain, acupuncture and TCM can provide real relief. Low back pain presents a challenge for physicians because in many cases there is no clearly discernible cause. Imaging scans may help us get a picture of structural damage to the spine, but they do not tell us the whole story. Pain is not just about structural or mechanical problems in the body. The problem may be mechanical, but it may also be chemical, emotional, behavioral, sociological, or a combination of any of this. The American College of Physicians has just recently issued new guidelines regarding the treatment of low back pain, specifically advocating that doctors and patients first choose natural and alternative therapies, such as acupuncture and massage, over pain medications. Acupuncture does not only address the immediate source of pain. TCM treats the whole person. An acupuncturist will study the different factors of each patient's unique presentation of symptoms in making a diagnosis and designing a course of treatment. This will include not only acupuncture, but food guidelines to support the healing of the body, and specific exercise and nutrition advice to strengthen the whole body from the inside. Low back pain can take its toll on a person's psychological outlook. Stress and depression can turn an acute problem into a chronic one. Treating the underlying causes of an acute condition can prevent it from becoming recurrent or chronic. Thank you very much for your attention.